I'm Karl Klusmann. I'm the head of internal medicine at Worcester Hospital. A little bit about myself. My role in Worcester Hospital as head of department is, and specifically with regards to the students, are to make sure that the apprenticeship that you would get in the rural clinical school, whether you do the longitudinal module or the rotations through the departments, that the patients, the burden of disease that you are going to be exposed to, that it's appropriate for your training. The model that we've set up and that we believe in is a model of an apprenticeship. You work closely with us, you're with us on the rounds, you see how we go through our day-to-day and how we deal with patients. You work with us and even after hours, and through that you would do your training. The format of tutorials and discussions is very informal. It's around the patient, around the bedside, on ward rounds, but we also have a structured academic program for both the longitudinal students as well as the students that do the 7-week rotation in Worcester Hospital in our department. In the Worcester model, where you rotate through our department, there will be only 3 students at a time, and you've got a whole team of 11 doctors that you have a connection with in different times and on a rotational basis. So your exposure to different ways of doing things and different reasoning methods I think is a very big opportunity and a plus for a rotation through the rural clinical school. You would work in your own ward in a smaller subgroup of our department for a week, and then you would rotate to the other aspects of internal medicine. You will see outpatients, you will see emergency center type patients, you would see ward patients, and you will experience and see and observe many forms of procedures. Because we are geared to do most of our investigations and procedures ourselves, you get an exposure to a very broad spectrum of internal medicine, which is a very a good opportunity for a student to prepare himself for internship. You will also, because we've got this very self-sustaining unit where we don't just refer everything to a tertiary unit, or where we don't have a subspecialty division in our hospital, we have to do most of general medicine ourselves. You will be able to train in procedures and basic and sometimes more complex procedures and investigations, and that would also build your confidence. And I think the feedback from our students is that that is an exceptional experience that they do have here. For the longitudinal students, again, apprenticeship of a year working in a community and environment in a district hospital is it's a wonderful time, and it's not, you do not get any exposure to your specialists. We go to the district hospitals at least on a monthly basis, and we also have every alternative week we have exposure to the students through tutorials and Skype method. So we do have contact with you and you're part of our team. We just know you are off site and we try and get connected. We are available by cell phone, email, and telephone. So we as specialists in Worcester Hospital take our training and take the training of the students in the longitudinal model just as seriously. We've got a good track record with results in the exams, and so the training that you get here and the assessment that you get here is totally appropriate for the assessments that you get at Tygerberg, and our students do not struggle at all when they get to their assessments at Tygerberg. So we understand that the student is mainly concerned about getting good marks and passing, and that the even the fact that they get trained away from the tertiary institute, that they will be appropriately prepared for the final year assessment. And we can guarantee that. We take a lot of pride in the product, and that should be a big reassurance for anyone that considers the rural clinical school. And we invite you. We enjoy our students. We become a little bit of a community during the year, and the proof in the pudding is to come and see how many of our junior doctors were students in the rural clinical school, how many do come back, and there are many. And I think that is part and parcel of the success of the rural clinical school, and hopefully you can be one of those and build your career from here.